Dr. Vinod Kumar to put all these vaccines which are available in perspective and what should be the step forward for us to take to make it into practical policy. Dr. Vinod Kumar, please.
Professor Ashok Rattan, I am back. We have learned a lot from the plethora of information by the excellent speakers, and we are still, you will agree with me that we have to struggle with a mountain of infections to our mankind, and also we have a plethora of information and lots of research is being done, has already gone in, and it continues. So my job at this time is to find out how these vaccines, which are available and are in a continuing process of development of more effective, less uh, less side effect, these kinds of vaccines are coming in. So our problem is how to get these vaccination down to the grassroots level for the mankind at a mass level in our country. So I have put some ideas together, and before I go to those ideas, I will just very briefly mention that there are certain barriers to adult vaccination which are existing. They are quite well known. There is a lack of perfect surveillance data, both active and passive surveillance, lack of national guidelines for adult vaccination, and there is a continuing precedence for treatment, for tertiary treatment or secondary treatment over the primary prevention. That is the that is a kind of mindset that our population has. And the health cares are also to be blamed to some extent because they are having some kind of clinical inertia. They are probably not tuned to gear up for giving vaccines to the individuals. I wanted to show is about vaccine hesitancy and other restraining factors. There is a great lack of awareness about the importance of vaccination in our country. There is not good availability for the masses. There is not much awareness about the real efficacy of many vaccines, and many people think that there are a lot of side effects, and people are not aware, even healthcare are not aware that although the vaccines are for vaccine preventable diseases, but they indirectly or directly impact the NCDs and improve quality of life. So what people think, well, they say if we are healthy, why vaccinate? And other people think it's only for children, it's not for adults, because this is what they have been tuned right from the beginning. And there is a big problem of cost and affordability. Many people cannot afford the vaccines, are quite expensive, most of them, and there are many religious, cultural, and even political beliefs. So there is an anti-vax lobby which is going on all the time. And for example, uh, there has been reports of association of autism with MMR vaccine, GBS for with influenza, DPT, and meningococcal vaccine, autoimmunity with HPV, but they are all either statistically insignificant or unfounded. So this is just a lobby, it is not a reality. The last one, COVID-19 vaccine, you remember that there were reports about rare thromboembolism and DVT, etc. But vaccine benefits always outweighed the risk, and therefore people finally accepted it was getting a life-threatening infection. But there are two vaccines for which there has been a historical blunders. For example, polio by a pharma company called Qatar Pharma. Many polio paralysis cases were seen because of a defect in the inactivation of this vaccine. Another vaccine, Drangexia vaccine for dengue, there was a manufacturing defect and second attack of dengue was more serious. So except these two, the present vaccines which are available, there is no reason why should there be strong anti-vax lobby. So there is a 20-point program to way forward for practical adult immunization in India. This is not any official program or anything like that. These are just 20 points that I have put them together, 10 on this and 10 will I show later. There need to be a strong surveillance system national task force need to be established. The vaccination should be part of various government schemes. It may be linked with Ayushman Bharat scheme, although it is basically uh, not only primary but secondary and tertiary care also. And it should become a part of occupational health. And this it should become a part of universal immunization program that is applicable to children, but it should be aligned with UIP and it should be deliverable at primary health center. And we should have a national vaccine policy, like we have an vaccine policy 2011 for children. We have no such policy for adults. And digital technology has been shown to be very effective at the time of COVID. So same thing can be applied for the other vaccines that we are going to recommend, or we should recommend for our people. And VPD's registry is important, and it should be age-wise registry. And there needs to be a lot of research to be done, implementation and evaluation. I would go into a little bit of more dilatation of these points later on, but this is another 10 points. Public campaigns, World Immunization Day or World Immunization Week. We know that there is a World Immunization Day on 10th November by World Health Organization since 2012. But we have no such day in our country. That needs to be important for mass awareness. Then we should follow some international best practices. We have to somehow bring down the pricing, and cost is too much. And many people cannot afford, and it should be made free for at least certain eligible 75 plus people. Incentive may have to be given as a temporary measure for various stakeholders, including healthcare providers, and there should be more dedicated clinics at various points so that they are within reach of the population. And there needs to be an intersectoral collaboration of not only government but a lot of NGOs, the professional bodies, the pharma manufacturers, and so on. And I think healthcare providers still need to be made more aware, and they need more training about the various aspects of vaccine administration. And this should find a place in medical curriculum, and there should be some departments of the government like health, education, or social justice should champion the cause of this vaccine. Now, I have put, based on this 20-point program, I have put some actionable strategies that might be useful for putting the practical establishment of these vaccines as far as our country is concerned. Some of these strategies are in place. They may need little more revamping, but they're a little busy slide, but I think it's important to share these facts. Firstly, both active or proactive as well as passive or reactive surveillance is important. Full-fledged adult VPD's registry is important, not just the adverse events following immunization, which has started by Health Ministry. Also, there is a need of full-fledged government-funded national vaccination policy. As I said earlier, national task force is important for guidelines, not only guidelines, but also for implementation, and not just different professional bodies giving guidelines. And these guidelines by different professional bodies like Association of Physicians of India or Geriatric Society of India and so on, these guidelines actually, they are not very uniform. There is some difference always, like for example, that route of administration, the number of doses that should be given for various, they're all little bit different and makes a person confused. So I think government has to come in and a task force to coordinate all these guidelines, and also for implementation is important. That there is a scheme of Ayushman Bharat, which is an expansion, and it is in the form of Ayushman Vayo Vandana, which you may have heard last year, December 2024, or I think October 2004. It was made open by the Prime Minister for 70 plus age people, under which they are given 5 lakh for treatment, but that is tertiary or secondary treatment. but I think it can be leveraged for certain elderly eligible individuals for preventive vaccination also. That will go a long way in reducing the cost factor and also in increasing the accessibility for some important vaccines for the elderly people above the age of 70. Then I think Ayushman Arogya Mandirs, which exist, which are health and wellness centers, they already give flu and TD shots, tetanus shots for elderly people, but they need to be more accessible. Then presently the National Health Mission includes tetanus for adolescence and pregnancy. And there is a very important government initiative called Massive Indradhanush. This is for high-risk adults. This includes 7 vaccines. This also includes 7 initiatives. That's why it's called Indradhanush. And there is also availability of disease-specific program for HBV, rabies in some areas, and Japanese encephalitis in some areas. And there is also a provision for flu and pneumonia vaccine for elderly, particularly under the program of what is called NPHCE, that is National Program for Healthcare of the Elderly by the Ministry of Social Justice. But there are concerns because the supply and availability of these vaccines for 75 plus elderly, for which it is mandated, is not forthcoming all the time. And AB Ayushman Bharat Digital Mission to track, like we had UVIN for Corona. This can be, we have a lot of experience on Corona, and this can be utilized for vaccination for other vaccines also. Then I think there is something existing, one should mention, that for occupational health, government does encourage the various employers based tetanus for organized sector. This is facilities only for organized sector employees. Then for HCPs, healthcare providers, there is a provision of flu, MMR, and varicella. And for veterinarian, rabies, for industry workers, tetanus, hepatitis B and hepatitis A vaccine. And this, if it is improved further and uplifted, this will reduce absenteeism and this will reduce outbreaks and illnesses, and it will also increase the work productivity in our country. So these are some, this is the last slide for me, and there are some additional strategies for 20-point program. I think we need to have public campaigns and to educate the public for vaccine benefits, dispel all the myths, and impress upon the importance of life course importance for by various channels like media, social networks, and community engagement. And we should start observing immunization day or a week, either in November, more likely in November, when the flu starts peaking and pollution begins, and sometimes even in April before the travel and vaccinations begin for the general public. The best practices that I can think of are implementing life course care, assessing the vaccination status, and providing the information, all the information about vaccine, and administering the vaccine itself and updating the vaccine record even at the first clinical encounter of an individual. This is one of the international practice going on in some countries. Another one is creating awareness about the cost benefit ratio. I think the people have to be told, and all the stakeholders have to be told that the benefit of vaccination outweighs the cost. And anyway, we have to deal with the cost factor at a separate issue, and cost cutting has to be done in collaboration with pharma manufacturers. And I think if there is a increasing awareness and accessibility of vaccination for the large masses, the cost is going to come down. And I think that for at least 75 plus elderly, and elderly, as you have heard all through the webinar, they are more prone to get all kinds of vaccine preventable diseases which have impact on NCDs also. So at least for 75 plus, it should be available free. And I would like to say that there is a existing what is called Senior Citizens Welfare Fund, which was established in 2016 by Ministry of Social Justice and Empowerment. This fund, the money comes to this fund from the unclaimed money of senior citizens after 7 years if nobody comes to claim that money. And there are crores of rupees in this fund at this time. Although this amount of money is not enough for giving the vaccination for all the elderly people, but at least in certain cases, if there are catastrophes, for example, if there is an earthquake or there is a spread of or outbreak of any disease, there at least 75 plus or some senior citizens should have access to this fund. Because these days, for example, I can give you an example, Senior Citizen Welfare Fund is being utilized for distributing free assistive devices for elderly. And you know, for well-to-do who travel by air, when we reach an airport, there are golf carts which we use golf cart. The elderly senior citizens are using golf carts at the airport. These golf carts all over the country, they are also being funded by the Senior Citizens Welfare Fund. So why not think about it for the vaccination cost also? And there again, as I told you, National Program for Healthcare of Elderly by the Ministry of Health has a mandate to provide flu and pneumonia vaccine for 75 plus. Although there are concerns about the proper supply at the right time, so there are some concerns, but it is available for the entire country. Then I think one of the things, as I mentioned earlier, incentivize public as well as healthcare providers, both by monetary and non-monetary means, to overcome the vaccine hesitancy, enhance the accessibility, and recommending by the healthcare providers to the public and actually administering the vaccine. So maybe some incentivization, maybe as a short-term measure, may be useful. Then I think some of the people did mention where the vaccine clinics are available, but we need to increase in a very large number of dedicated vaccination clinics available for the public at more hospitals, various health centers, even pharmacies, diagnostic centers, nursing homes, even schools and travel centers, and even home service delivery of the vaccination is available in some places. There are few of these hospitals already and other centers are already available, but I think the population is so large and the vaccination demand is so important. We have to increase these vaccination clinics at various other places. And then intersectoral collaboration between government, NGOs, medical colleges, professional bodies, private practitioners who are the GPs looking after the entire population, and vaccine manufacturers important. Public-private partnership is, if necessary, has to be forged. And as I said earlier, health, education, and social justice department should champion the cause in a big way. So these are some of the ideas that I thought I'll put them together, through which we might be able to advance ourselves with the blessing of political will to put the practical establishment of adult immunization for the country as a whole. Thank you very much. That's all. I'm stopping the screen sharing.